Carpal tunnel syndrome is often referred to as the computer engineer's and graphic designer's disease or housewife's disease. But is it really a syndrome or a disease? Questions you may have. What are the symptoms of carpal tunnel syndrome? How exactly do they develop, and what causes make them worse? Can I test for it at home with simple methods to confirm if I have it? What are the treatment options for this condition? Are there exercises I can do at home to relieve the symptoms? If treatments don't work and surgery becomes necessary, what are the steps of the procedure? A new and important video is coming up, stay with me. Greetings, and welcome to the Octopus Pharmacist channel. I am Hussein Lotfi, presenting a new episode in the A to Z series. Today's episode will be slightly longer due to the presence of crucial details. Below are the key topics covered in this episode. If you are interested in a specific section, you may skip ahead to the relevant part. However, if you wish to gain a comprehensive understanding of this syndrome, I encourage you to watch the entire episode from start to finish. Anatomy and function of the wrist and hand. To begin, let's examine the anatomical structure and function of the wrist joint and hand. We will explore how the brain controls finger movements, the role of nerves, and the normal functioning of these structures. The human brain regulates muscle activity through electrical impulses transmitted via nerves. The primary nerve responsible for hand movement is the median nerve, which plays a crucial role in motor control and sensory perception. This nerve predominantly innervates the thumb, index, and middle fingers, along with partial control over the ring finger. However, the little finger and part of the ring finger are mainly controlled by other nerves. Structure of the wrist. The wrist is composed of 8 interlocking carpal bones, arranged in a U shape. This configuration forms a tunnel-like structure known as the carpal tunnel. The roof of the carpal tunnel is formed by a strong, thick ligament called the flexor retinaculum. This ligament provides stability to the tunnel but has limited flexibility. Contents of the carpal tunnel. Inside the carpal tunnel, several important structures are present. Flexor tendons, these tendons connect to the muscles responsible for finger movement. Median nerve, this nerve passes through the tunnel and is essential for controlling the first 3.5 fingers of the hand. Blood vessels. The ulnar and radial arteries supply blood to the hand, but they are located outside the carpal tunnel. Functionality of the hand. With this anatomical arrangement, the fingers can move independently or in coordination, allowing for precise movements essential for tasks such as writing, grasping, and performing fine motor activities. Symptoms and causes of carpal tunnel syndrome. Symptoms of carpal tunnel syndrome. Carpal tunnel syndrome, CTS, presents with several characteristic symptoms, primarily affecting the first 3.5 fingers, thumb, index, middle, and part of the ring finger. These symptoms include numbness, tingling, and electric shock sensations. Individuals may experience sudden sensations of numbness, tingling, pricking, or electric shocks in the affected fingers. These symptoms can occur at rest, during work, or even while sleeping. During sleep, symptoms often arise due to excessive flexion of the wrist, which increases pressure on the median nerve. Progressive pain and weakness. Initially, pain may be mild and tolerable but gradually worsens over time. In advanced cases, individuals may struggle to grip objects, leading to dropping items unintentionally. Pain may also become severe enough to wake the person from sleep. Involuntary hand movements. Individuals often shake or move their hands forcefully to relieve the discomfort, which is a natural response to reduce pressure on the nerve. Muscle weakness and loss of function. If left untreated, persistent compression of the median nerve leads to muscle weakness in the hand. In severe cases, individuals may struggle to lift objects due to impaired nerve function. The condition progresses because the carpal tunnel narrows, causing increased pressure on the median nerve. This compression reduces both nerve signaling and muscle strength, leading to functional impairment. Causes of carpal tunnel syndrome. Several factors contribute to the development of carpal tunnel syndrome, but the main causes can be categorized into four primary groups. Underlying medical conditions. Certain diseases increase the risk of CTS, including rheumatoid arthritis, an autoimmune disorder where the immune system attacks the wrist joint, leading to inflammation, fluid retention, and swelling, which narrows the carpal tunnel. Diabetes mellitus causes chronic nerve inflammation, diabetic neuropathy, exacerbating symptoms such as tingling, numbness, and pain. Hormonal and metabolic factors. Fluid retention in the body can lead to swelling within the carpal tunnel, increasing pressure on the median nerve. This is commonly seen in pregnancy, weight gain and obesity. Pre- and postmenopausal women, due to hormonal changes, particularly fluctuations in estrogen, which contribute to fluid retention and tunnel narrowing. Repetitive hand movements and occupational risks. Carpal tunnel syndrome is prevalent among individuals who perform repetitive wrist movements. This condition is often referred to as the graphic designer syndrome or computer workers syndrome because it frequently affects office workers, graphic designers, individuals who use a keyboard and mouse extensively. Poor hand positioning and prolonged wrist flexion can lead to swelling and progressive narrowing of the carpal tunnel. Genetic and anatomical factors. Some individuals are born with a naturally narrower carpal tunnel, increasing their susceptibility to nerve compression. Symptoms may not appear in early life but can develop with age as the median nerve experiences prolonged pressure over time. Self-assessment for carpal tunnel syndrome, simple at-home tests. If you are experiencing symptoms of carpal tunnel syndrome, CTS, and want to perform a preliminary assessment before consulting a doctor, there are 3 simple tests that can help indicate whether you might have this condition. 1. Carpal compression test, Durkin's test. This is one of the most widely used tests for CTS. To perform the test, press firmly with your fingers over the carpal tunnel area on the wrist. Maintain this pressure for 30 seconds. If you experience numbness, tingling, or discomfort in the thumb, index, or middle fingers, this strongly suggests median nerve compression, which is characteristic of CTS. 2. Phalen's test. This test evaluates nerve compression during wrist flexion. To perform the test, place both hands together with palms facing downward, like a reverse prayer position. Press the backs of the hands firmly against each other and lower them slightly. Hold this position for 60 seconds. If tingling, numbness, or discomfort develops in the first 3 fingers, CTS is likely. 3. Tinel's sign test. This test assesses nerve irritation by applying a light tapping motion. To perform the test, gently tap on the median nerve at the wrist, around the middle of the palm side. Continue tapping for 60 seconds. If this tapping induces numbness or tingling in the thumb, index, and middle fingers, it suggests median nerve involvement and possible CTS. Next steps: seeking medical confirmation. If you experience positive results in these self-tests, it is important not to ignore the symptoms. A specialist, usually an orthopedist or neurologist, can confirm the diagnosis using nerve conduction studies, NCS, to measure how well electrical signals travel through the median nerve. Electromyography, EMG, to evaluate muscle function and nerve connectivity. These tests help determine the severity of nerve compression and guide appropriate treatment options. Non-drug treatment, exercises for carpal tunnel syndrome. For individuals with carpal tunnel syndrome, CTS, specific exercises can help reduce pressure on the median nerve, promoting improved nerve function and reducing symptoms. These exercises can be performed alone or alongside medications to enhance treatment outcomes. Benefits of these exercises: help relieve pressure on the median nerve, improve blood circulation and nerve mobility, enhance wrist flexibility and strength over time, Exercise 1, Wrist and Neck Stretch. Purpose: to relieve pressure on the median nerve and improve wrist flexibility. Steps: place your hand firmly against a wall with fingers spread wide. Slowly bend your wrist backward, extending your fingers outward. While maintaining this position, tilt your neck toward the same side and hold for 5 seconds. Return to the neutral position and repeat. Perform 10 to 15 repetitions per session. Repeat this exercise 3 to 4 times per day. Exercise 2, Wrist Flexion and Extension Movements. Purpose: to stretch and mobilize the wrist, reducing tension in the carpal tunnel. Steps: bring both hands together in front of your chest in a prayer position. Lower your hands as much as possible while keeping them pressed together. Hold for 5 seconds. Relax your hands briefly. Bring your hands back to chest level, press them together, and hold for 5 seconds. Relax again. Keeping your hands in front of each other, push them downward while leaning slightly forward, applying a gentle stretch to the wrist. Hold for 5 seconds. Perform 10 to 15 repetitions per session. Repeat this exercise 2 to 3 times per day. Conclusion: these simple yet effective exercises can be easily incorporated into daily routines at work or home. Regular practice can help alleviate symptoms, enhance wrist flexibility, and support the overall management of carpal tunnel syndrome. Comprehensive treatment approach for carpal tunnel syndrome. Managing carpal tunnel syndrome, CTS, involves a structured, step-by-step treatment approach. Some treatments can be used simultaneously, while others are sequential. The choice of treatment is determined by the doctor based on the severity of symptoms and patient response. Step 1, Cold and warm compress therapy. Cold compresses: first 2 days, apply ice packs for 5 to 10 minutes, 4 times daily. Effect: vasoconstriction, narrowing of blood vessels, reducing fluid leakage, inflammation, and pressure on the median nerve. Warm compresses: after 2 days, apply heat for 5 to 10 minutes, 4 times daily. Effect: muscle and nerve relaxation, improving circulation. Note: some sources recommend alternating hot and cold therapy, but the most effective method is cold first, then warm. Step 2, Pain management. Over-the-counter pain relievers, NSAIDs like ibuprofen, help reduce pain and inflammation. Caution: certain individuals, such as those with ulcers, asthma, hypertension, or kidney disease, should consult a doctor or pharmacist before use. Step 3, Vitamin and supplement therapy. Vitamin B12, for nerve regeneration. Initially, high-dose injections, every other day or twice weekly for a month. Maintenance: 1 to 2 oral tablets daily for long-term use. Thioctic acid, alpha-lipoic acid. 600 mg tablets taken 1 hour before meals, up to 3 times daily. Supports nerve sheath repair and reduces tingling sensations. Step 4, Prescription medications. If symptoms persist, doctors may prescribe gabapentin, controlled medication, reduces nerve inflammation and pain by affecting the central nervous system. Diuretics, water pills, decrease fluid retention, reducing pressure in the carpal tunnel. Requires medical supervision due to possible side effects. Step 5, Wrist splints. Prevents excessive wrist flexion, especially during sleep, most effective time for use. Can be worn during daily activities for 3 to 4 weeks if necessary. Step 6, Physiotherapy, thermal wave therapy. More intense than warm compresses, applying deep heat to relax muscles and reduce nerve pressure. Step 7, Corticosteroid or progesterone injections. If symptoms persist for 1 to 3 months, the doctor may inject. Cortisone reduces inflammation by lowering immune response in the affected area. Progesterone, in female patients, has a similar anti-inflammatory effect and is sometimes used instead of cortisone. Important: These injections must be performed by a specialist to avoid complications like tissue fibrosis. Surgical interventions, steps 8 to 10. If non-surgical treatments fail, surgery may be required to relieve pressure on the median nerve by cutting the transverse carpal ligament. Step 8. Endoscopic carpal tunnel release. A minimally invasive procedure using a tiny camera to guide the surgeon in cutting the ligament. Faster recovery with minimal scarring. Step 9. Open surgery. Traditional approach: a larger incision is made to expose and cut the ligament. Provides direct visualization but requires a longer recovery period. Step 10. Mini open carpal tunnel release, center, with infrared (IR) technology. Uses infrared cameras and sensors to precisely map the median nerve and blood vessels before cutting the ligament. Offers high precision while minimizing surgical trauma. Post-surgery care and lifestyle modifications. Rest and avoid heavy lifting for several weeks. Some individuals may require bracing post-surgery. Pain management may continue for months, as some patients experience post-surgical discomfort for up to a year. Weight management and metabolic control, for diabetic or hypertensive patients, are crucial for preventing recurrence. Final thoughts. With proper diagnosis and treatment, most individuals recover within a few months. Early intervention significantly improves outcomes and reduces the need for surgery. Thank you for watching. If you found this information helpful, please support the channel by liking, subscribing, and contributing on Patreon or PayPal. Stay healthy, Hussein Lotfi.